Hi everyone, Dr. Paymer here at Mid-Ohio Functional Wellness. Did you know that 1 in 16 Americans have some type of thyroid disease, which is a medical tragedy of itself? But the scary thing is that nearly 2/3 of people are walking around with it and don't even know it. Doctors often miss an underactive thyroid because they're using the wrong test to help them diagnose it. They still rely on a series of blood testing that shows us how much thyroid hormone is circulating in the blood, but it doesn't do anything to tell us how much thyroid the body is able to use or how much is necessary to ensure an individual's health. So there is a lot of discrepancy and misdiagnosis in the world of thyroid disorders. There's actually many causes to thyroid issues. Most thyroid actually begins as adrenal fatigue or adrenal stress, which can often mimic symptoms of thyroid. Other contributing factors can be a yeast called Candida albicans, which, if left unchecked, can cause a myriad of symptoms, as well as bacteria like Helicobacter pylori. All of those can cause autoimmune stress. Also, any number of foods, especially gluten or dairy, will set up a continuous autoimmune situation that goes unnoticed, again, because the tests that are used don't really get the full picture and show what's really going on. So because of the misunderstanding of thyroid and the lack of accurate testing, doctors have actually swung the other way. Instead of not diagnosing thyroid, they're very quick to diagnose a thyroid issue and dole out prescriptions. Often the drug, the levothyroxine is probably the most commonly prescribed. But the problem is that now people have many serious side effects from an excess of thyroid hormone circulating in their system because it really wasn't the underlying cause. And it certainly doesn't do anything to correct the problem. It just masks it for a time. There's many ways that we can analyze the thyroid to see if it is indeed an issue, and we're able to determine what other underlying factors are there to bring a person back to health. And we want to do it without the use of drugs and medication if at all possible. That's what we do for our patients here at Mid-Ohio Functional Wellness. We want to look to the source. We want to look at whether it's nutritional causes or lifestyle causes. What is the full picture? So hope that sheds some light on the subject for you. If you're experiencing fatigue and can't find a reason for it, I'm going to tell you that's not a normal situation that should be occurring for you. Fatigue is very common, unfortunately. As I said, 1 in 16 people suffer from thyroid issues, but it's not something that you have to live with, nor should you. So if we can help, let us know here at Mid-Ohio Functional Wellness in Ashland, and hope that helps.